Hello, everyone. So I wanted to make a PowerPoint presentation to share with other nursing students that are studying for exams. I am, disclaimer, not a instructor or anything. I'm just a nursing student that is studying for her exams, and I've found that these PowerPoints help me to study by making PowerPoints and then sharing them with others and hoping that they also help you guys share. I don't know if I put this in present mode, if it shows, so I'm just gonna keep it like this. So if it'll let me go to the next slide, here we go. So I'm going to talk about stress hormones. Stress can lead to changes in serum levels. I don't know why I can't say that word. I mean, it's not a hard word. But I can't. Hormones including steroids, catecholamines, growth hormones, and prolactin. So some of these are important or necessary for fight or flight, which we're going to go into a little more and on the next couple slides. So let's break this down. So the normal level of serum, that's not right, but whatever, it's 3.4 to 5.4 grams per deciliter. So steroid medications, they help fight inflammation, and they also work with the immune system. Like some of them are cortisone, hydrocortisone, prednisolone. So most steroidal medications end in SON or LON. So keep that in mind when you're testing, because even if you don't know the medication that you're seeing and it ends in SONE or LONE, you know it's most likely a steroid. So catecholamines, those are hormones that are produced in the brain, in the adrenal glands, in the nervous tissues. That's dopamine, epinephrine, neuroepinephrine. So then there's also HGH, the human growth hormone. Those are also produced in the brain, in the pituitary gland, which is located at the base of your neck. I'm sorry, the base of your brain, not the base of your neck. And then prolactin, which that stimulates breast development and milk production in women, and is also produced in the pituitary gland. So what's fight or flight response? This is a physiological, not psychological, a physiological reaction that occurs in response to a perceived harmful event, attack, or threat of survival. I'm sure that most of us have all had some kind of fight or flight response in our lifetime, maybe a car accident, or, your sibling scares you, or I don't know, a cat jumps out at you during the night. So the sympathetic nervous system stimulates the adrenal gland when you have a fight or flight response, and this triggers the release of catecholamines, which, if we remember back, catecholamines were I guess I just can't slide back. This not presenting things. Catecholamines is the epinephrine, the dopamine, and the neuroepinephrine. Okay. So some of the body that is affected by stress. So our heart, that is an increase in heart rate and dilation of the coronary blood vessels. For circulation, again, it's dilation of blood vessels that serve the muscles, but also it constricts blood vessels serving the digestive system. Why? Is because we don't need to digest food when we're in a fight or flight survival moment. So the lungs, it dilates your bronchi, which increases your respiration rate. Now, this is only in fight or flight response, which is important in one of our review questions that we'll get to later. So the liver, it increases the conversion of glycogen, because glycogen is broke down in the liver, don't remember that, into glucose. And so when we're in a fight or flight response, our liver will turn glycogen into glucose. So the skin, you become pale, flushed, because your blood flow is reduced. And now I know when you've been scared in the past by somebody, I'm sure someone's like, what happened to you? You look like you've seen a ghost. And that's where that came from. And our eyes, they dilate, the pupils dilate. I find this to be quite interesting because they dilate, which allows more light so that we can scan our nearby surroundings more. Because we're in a fight or flight situation, we don't need to know what's happening a mile down the road, and our body responds to that. So it's pretty amazing when you think about our body and how it reacts to stuff differently like that. So the main stress hormone is cortisol, and this increases sugar, glucose, in the bloodstream, and it enhances your brain's use of glucose and increases the availability of the substance that repair tissue. So this is important. And in our next slide, we'll talk about the signs and symptoms of chronic stress. So this is chronic stress, remember, not fight or flight. So with chronic, and this is important when you're taking a history of a patient in your assessment. So chronic signs of stress are fatigue, irritability, headaches, intestinal problems such as constipation, bloating, and diarrhea, anxiety and depression, increased blood pressure, low libido, erectile dysfunction, or problems with regular ovulation or menstrual periods. So also difficulty recovering from exercises, poor sleep patterns, muscle pain or tension in the head, neck, jaw, or back. And now if you were like, I have all of those, but it hasn't been 6 months, don't worry. Chronic stress for nursing students, it's a week. After 1 week, you're already in chronic stress. So, all right, moving on to assessment. So, a priority in assessments is the evaluation of signs and symptoms, which we just went over, and this is associated with association with disease. So this is our first review question, which states, which question would best assess a patient's ability to deal with a stressful situation? Now, before we get into the answers to this, I want to go over just a little hints on answering questions. And I'm sure your instructors in all your classes are going to tell you pretty much the same thing, or other students, they'll tell you, look for what's important, what stands out in the question. And so if you look at this question, which question would best assess a patient's ability to deal with a stressful situation? We're looking at their ability to deal with a stressful situation. We're not looking to see if they're stressed right now. We're looking at their ability to deal with with stress. Okay, so A, are you currently experiencing stress? Would we ask that if we're looking at their ability to deal with stress? I don't know. B, have you experienced any changes in your life recently? Now, are we trying to figure out if they are stressed right now, or are we trying to figure out their ability to deal with stress? C, how have you responded to stressful situations in the past? Or D, are you experiencing feelings of anxiety or nervousness? And if you didn't pick up on that, the answer is C. So we'll go over to C. Oh, oops, can't just hit. Oh, goodness. So we're looking at their ability to deal with stress. The answer was C. How have you responded to stressful situations in the past? We're not asking them about their stress right now. In the question, we're asking them about their past stress. With their in the question, we're asking them about their ability to deal with stress. So we want to know how they've dealt with stress in the past. So stress is identified in your assessment. It is identified in your psychosocial component of your history. There is a stress scale that you can use, the Holmes and Rahe stress scale. It has 43 questions that list events on there. Some of the questions are, have you recently had a loss of a loved one, or stuff like that. You can go on this link right here and download a PDF version. You can take it for yourself, or you can just save it and go over it. So if you look, 150 points or less is a relatively low amount. 150 to 300 points, you have 50% chance of health breakdown according to the Holmes statistical prediction. And 300 points or more, 80% of health breakdown in the next 2 years. So that, let's see. Whoops, I'm moving myself around here. So, another review question. Which observation made by the nurse while obtaining a health history signifies a patient may be actively stressed? Now, here's the key word in this: actively stressed. The patient is sitting still and calm on the exam table. B, the patient is talkative and expressive during the assessment. C, the patient appears withdrawn and is unable to sit still in the exam room. Or D, the patient has a normal gait and adequate posture for age and height. If you guessed, the patient appears withdrawn and unable to sit still in the exam room. So if you go back and you look at this question, A, B, and D would be things you would expect if you're doing an assessment on just like a routine exam or something like that. But if the patients come in with signs and symptoms, or a family member brought them in, because usually they're not going to come in on their own, and they brought them in because they're going to have some kind of signs and they're going to have some kind of symptoms that are observable, and so the patient appears withdrawn, that's something you're observing, and the patient is unable to sit still, they're anxious. So they have anxiety, they're anxious, and that would be why the answer would be the patient appears withdrawn and unable to sit still in the exam room. Let's move on to the next review question here. Just going to have to move myself over here. So, which symptom exhibited by the healthy adult patient would indicate the cardiovascular system is affected by stress? Select all that apply. A, heart rate of 120. B, blood pressure of 147/90. C, respiration of 28 beats per minute. D, diarrhea and abdominal pain. Or E, complaints of visual changes and headache. The next slide gives us the answers, but I checked one that I didn't actually mean to check, and I have to still fix that. So I will go over that, and I will also tell you why the one I did check is incorrect. So on this, I put A, B, and C. Heart rate of 120, BP of 147/90, and C, respiration of 28. It is not a respiration of 28. Now remember, in this question, it is just A and B. In this question, we're saying a healthy adult patient would indicate a cardiovascular system is affected. So if you look at it, it says cardiovascular system. Respirations is not part of the cardiovascular system. It's part of the respiratory system. Also, it is a healthy adult patient. Now, they're not healthy. they're clearly under some chronic stress. But you can see a normal person walking around with a heart rate of 120 and a blood pressure of 147/90. That's why they make medications to treat those. So that's why respiration of 28. It's not one of the answers. It's A and B. And so here is my citation that I wanted to share that I thought you can go read. It's a really good read. It's a peer-reviewed article that is on the .gov website. So it's from the Journal of Endocrinology and Metabolism. And you can check that out. It has a lot more information. I hope that this video has helped you in studying. I do plan on making more. So if it has helped you, please look for those and have a good day.